But for now, I would like to introduce our first speaker, who is Allan Crosbie. He's a teacher and he's a member of the EIS. He's speaking in a personal capacity. We're particularly grateful, Allan, that you've come today, despite a very difficult personal situation. This is why Allan's speaking first, and he will need to leave right after he speaks. Thank you for finding time for us today, Allan. Over to you.
So thank you. Good afternoon. Thank you for inviting me to speak today. I may be able to stay on afterwards. Later in my presentation, I hope to come back to the issue of what it's been like working as a teacher in Scotland in the context of the questionable public health positions regarding transmission in schools that we explored this morning. But before that, I'd like to talk a bit more widely about some challenges that I think might be facing the Zero COVID movement from an activist perspective. Although, as you've said, I'm a national EIS activist, I'm speaking to you today in a personal capacity. The EIS does not currently have a policy on zero COVID, but it is in the process of developing one. It's my own view that the zero COVID movement will not influence the Tory government without broad-based UK-wide trade union pressure, but I believe that's going to be hard to achieve. Even amongst my union colleagues, there is a degree of scepticism, especially because of the harms caused by extending lockdown on groups of workers who do genuinely fear that their sectors will be permanently harmed or destroyed altogether, and who may believe that the recovery of their sectors will require, if you like, a third way or a middle path involving earlier releases from restrictions than the zero COVID approach might recommend. In other words, there is some hesitation and reticence among my fellow activists who, very understandably, don't necessarily want to take a strong supportive stance on zero COVID because lockdowns don't affect us as teachers financially, because we continue to work and be paid throughout remote learning, but they will impose further hardship on other workers. So I suppose this first half of my contribution today is really to pose that challenge and to seek from you in our discussions later some suggested ways forward for trade unionists who support the maximum suppression strategy, but who don't want to alienate colleagues and other trade unionists who take a different stance. I fear that my own view on the answer to that challenge could be seen as somewhat utopian and naive. I believe the answer lies in universal basic income and the kind of economic restructuring that a Green New Deal would bring. We know, for example, that there are workers and trade unionists who support Trident renewal or continuing with fossil fuel extraction because they fear the impact of the alternatives on their members' livelihoods. Our response to that position is, of course, that a just transition will not see you lose your employment. It will ensure a guaranteed retraining or redeployment of your skills into new green industries. In the same way, I would argue that a zero COVID strategy and then a proper post-COVID recovery must involve a rollout of universal basic income for those most affected to ensure their livelihoods. And then a long-term transition which tilts away from an economy based on retail, tourism, and hospitality, and the way those things are entwined with wealth extraction, because they're so rooted in property ownership and rent, and more towards one based on sustainable industries. But I do worry that that sounds far too long-term, pie in the sky to furloughed workers who are suffering right now, and who realise that an emboldened Tory government currently getting away scot-free with blatant corruption and cronyism is not going to put any of that in place in the next 5 years. So there we are, colleagues, some food for thought for us maybe this afternoon. At this point, I'd like to say a few quick words about the scientific context outlined this morning and about being a teacher in Scotland in that context in these past 12 months. A very important question that we started to explore this morning is, why are other public health scientists, the ones advising the government, apparently so set against considering the data outlined by especially Dr. Gurdasani today, and apparently so against recommending measures like masks and physical distancing in primary schools? My view of at least part of the answer, and Deepti and others might think I'm being too generous here, is that it hinges on the balance of harms argument. Those scientists are convinced that there is another public health crisis affecting children that outweighs the risks regarding COVID and transmission in schools, namely issues regarding safeguarding and mental health, and the way those crises may affect the long-term educational development of our most vulnerable children. Those scientists continually talk in terms of irreversible educational damage, and they emphasize the inequity of the way these harms affect the poorest children and families. In order to emphasise those harms and to make sure they're given precedence by the government, they have to downplay opposing views on transmission. This was most starkly in evidence in Scotland in an advisory note from the Scottish SAGE Advisory Subgroup on Education published back in December, when they advised the government against moving to remote learning before Christmas. It was somewhat notorious for me, this report, and it's worth looking carefully at just a few things that group wrote in that December report. They said at that time, there's no evidence that schools and early learning centres are driving transmission, and there's no clear rationale for disrupting them and children's education. Closing schools for a 3-week period to reduce transmission would undermine the consistent message that schools are safe and would serve to amplify the concerns that had already been expressed by teachers about the safety of working in schools. They further said equity was regarded as a key consideration. School closures would have a disproportionate impact on the most vulnerable children and those living in poverty. Now, my view is that not only was that dangerous for the COVID health crisis, as our scientists this morning highlight, it was also, and it remains, a wrong-headed approach to the mental health and equity crises. And the reason is simple. Who are the children and families most likely to be sent back into isolation measures because of full-scale returns in primaries without masks? The poorest and those living in the vulnerable, most overcrowded communities. That's who. And notice that when they are, there will be no teaching staff available to support them remotely because those teaching staff will all be deployed in the school buildings. Further, who will suffer most from the continual yo-yoing in and out of lockdown because maximum suppression hasn't been pursued? Those same families. Actually, in the pandemic, blended learning, which ensures smaller class sizes, physical distancing and better ventilation, would be a much more equitable solution because there would be both remote and in-school teacher support for vulnerable kids and families. It would be planned properly and teachers would have greater capacity to reach out and support them. Beyond that point about equity during the pandemic, I think it will be very important in the post-COVID recovery period to remind those public health scientists of their concerns. Those children, and calling loudly for the resources needed to support them, something which teachers have been doing for decades, had better be at the top of the public health agenda. I hope they will be as keen then to voice teachers' concerns as they were during this pandemic to downplay and minimize teachers' concerns. We will have to wait and see. Educational damage will only ever be truly irreversible if poverty is allowed to endure. Thank you for listening and for having me today.